To begin my bedside assessment, I want to make sure that my patient has signed his informed consent. I'm going to begin by making sure I have my professional attire and some identifier as in the name badge. I would ask my patient what name he preferred to be called during the assessment. It is important to provide my patient with comfort, with dignity, and with privacy. I also brought a spare blanket, so I'll provide my patient with the appropriate dripping during the assessment as we go along. It is also important for me to communicate to my patient the processes that are being done, and also to communicate to my patient the expectations as well. For safety, the first thing I want to do to begin is proper hand hygiene. I will, of course, knock on my patient's door and get his or her permission to enter. I will greet my patient, and I would say, "Hi, my name is Chrissy," and I will also introduce myself. I am your nurse today. I will get from my patient his name and birthday, and I would verify that against my record in accordance with the MRI number. Sir, may you tell me your name and birthday, please?
John Smith, January 1st, 1920.
Can I take a look at your name band? And I want to make sure that his name band matches up nicely with my record, making sure to note his name and birthday are correct in accordance with his MRI number as well. It is important for me to ask my patient if he has any known allergies. Sir, is there anything that you are allergic to? Any medications, any foods, any latex, any tape, or anything in the environment?
No.
Okay. I'm going to move on to assess my patient's level of consciousness. I'll make sure that he's alert and oriented to person, place, and time. Sir, you've already told me your name, but can you tell me what city and state that we are located in?
Lehigh Acres, Florida.
And that is correct. I also want to assess time. What year is it?
2019.
Okay. I'm going to look at my patient's general appearance, and I'm also going to note for symmetry, so everything has to equally match to both sides. My patient has an IV tubing. I will go over to the IV tubing, and I will assess my IV tubing for any kind of tenderness to the sides. That's his IV tubing. Any tenderness to the sides, any swelling, redness, any infiltrates, and I want to make sure that my IV tubing is patent and it's not kinked. And after I have assessed his IV, then we can move along. So we've established that my patient has good level of consciousness, everything is symmetrical, and there's no signs of any visual distress. We want to move on to the next thing on my assessment, which is his hair, nails, and skin. So I'm going to inspect. I'm going to move my bedside table a little bit off to the side. I want to inspect my patient's scalp and hair for anything of that's unusual. I'm going to inspect my patient's nails and also his skin. Okay, you look at everything, make sure everything's looking over, make sure everything is correct and good. The next thing I want to check of my patient is his, I will document any irregular findings. I'm going to check my patient's skin turgor, okay, and it bounces back really good, has a really good rebound, so there's no signs of dehydration. And I want to check my patient's pulses and cap refills. Okay, so in this case, my patient's cap refill is less than 3 seconds, so I'll document any findings. We're going to move on to the next system where we're going to do head, ear, eyes, nose, and throat. I'm going to first take a look at the external ears. Okay, and then we're going to inspect the ears. We're also going to inspect the eyes. At this point, I would use my, one moment. At this point, I will use my pen light to look in my patient's eyes. Take a look at my nose while I shine some light into your eyes. Okay? And when I test my patient's pupils and make sure I document that they're perfectly equal, they're round, and they're reactive to accommodating light. And I'll also document the size of my patient's pupils. I'm going to take a look at my patient's conjunctiva, and I'm looking for any redness or any pale color, anything that's irregular. I'm also going to take a look at my patient's sclera and make sure that they're white and then they're not jaundice, and we're not worried about jaundice. After we've inspected his eyes, we're going to move on to his nose. I want to take a look at his nose. I'm going to look for any drainage, and I'm going to look at the color, any respiratory effort that are unusual. Then we're going to look at the patient's mouth and his oropharynx as well. Sir, can you open the mouth for me? tummy pressor. Okay, I'm going to take a look at the back of the throat. Okay, looks good. If there was anything unusual, I will document that in my patient's record. The next thing I want to do is have my patient do a nice big wide smile. Smile really big. I'm looking for symmetry. As you can see, the patient has a nice wide grin and there's no concerns. Okay, sir, thank you so much for that. We're going to move on to the next system, which is our respiratory system. Sir, have you had any trouble with shortness of breath, any trouble with breathing?
Nope.
Okay. I'm going to have you remove your shirt and I'm going to look at my patient's chest for any distress with respirations. Okay, take off your shirt for me, sir. I'm going to have you put on this gown. The gown is imaginary, of course. Okay. So when I look at my patient's chest, I'm looking for any kind of distress. When he breathes, I want to see how he breathes, if he uses his accessory muscles for breathing. And in his case, his breaths are even, okay, and they're easy, and they're unlabored, okay? And then he has no use of accessory muscles. I'm going to use my stethoscope, and I'm going to listen to his lung sounds, and I'm going to listen in all bases. Take a nice deep breath for me, in and out. So I have auscultated all my patients' lung sounds, and there was no irregularities. He's not been coughing. He has good and open airway. And we're going to move on to the use of the device. I'm going to teach my patient how to use the incentive spirometer. The incentive spirometer helps my patient to keep his airway open, and that's something that he can do in accordance, in addition to deep breathing and coughing. Okay, sir? With this incentive spirometer, I'm going to give you a goal, and your goal at this point is 1500 because we're just beginning. And when you do breathe when you breathe suck into this tubing, I guess it's called, you want to get to your goal, so you want to raise this bar up to your goal and kind of maintain it while that little bubble stays between the two indicator arrows. Okay? And the patient has the hang of the incentive spirometer, and he's able to get to his goal. And as he exceeds each goal, you want to raise the marker so that the patient just continues, and optimally you want to get to the very top if you can. But you want to look at the patient's, how the patient does, and check their efforts, okay? We're going to move on to our next system, so that's something that the patient will take home and continue to use upon discharge as well, which is also good until cleared by physician. We're going to move on to cardiac, and I want to first inspect my patient, of course, like we did at first. I want to go ahead and auscultate the carotids before I palpate. You also always want to auscultate carotids before you palpate, and I will do the carotids one at a time with the bell and also with the diaphragm. I'm going to move your, thank you, sir, thank you. One at a time. We're going to move on to inspection. I'm going to inspect his carotids. I'm going to turn your head to the side, please. Okay, good. And let's do the other side as well. Turn toward me. Okay, very good. And we're going to move on to the other pulses as well. 1 second.